In the field of medicine, there are different paths one can choose to take. We are going to go along the path of two different ones, cardiology and oncology.
Cardiology is a popular choice nowadays because the demand for cardiologists is constantly increasing. Cardiology is the study of diseases and abnormalities of the heart.
The term oncology literally means a branch of science that deals with tumors and cancers. The word onco means bulk, mass, or tumor, while logy means study. Today, millions of people are living with cancer or have had cancer. Cancer is the second leading cause of death in the United States. About 1/2 of all men and 1/3 of all women in the U.S. will develop cancer during their lifetime.
Treatments of cardiology and oncology have came a long way with the help of new technology and modern medicine.
Angioplasty is where a catheter that is tipped with a balloon is inserted into a blood vessel in the patient's arm or thigh. The balloon is then inflated. This process pushes on the plaque and squeezes the plaque until the artery is normal size where blood can flow through the artery again.
Bypass surgery is a more complicated yet more successful surgery. A portion of an artery that is blocked by plaque is clamped off. A blood vessel is then taken from another part of the body and inserted just before and just after the section of blocked artery. The inserted vein then gives the blood a new path to flow through. Bypass surgery is completely successful 70% out of all surgeries and partially successful 20%.
Pacemakers are used in patients who have bradycardia, which is slow heartbeat. When the pacemaker detects that one's heart is too slow, it emits electrical impulses. Each of these impulses triggers the heart to beat, helping it to speed up and attain more regular rhythm. To insert a pacemaker, an incision is made just under the left collarbone. The lead wires from the pacemaker are directed down the veins until they make contact with the heart. The other ends of the leads attach to the generator of the pacemaker, which is placed in a pocket created beneath the skin.
Radiation therapy is the use of radiation to help kill cancer cells. While chemotherapy is used to treat the whole body, radiation is only used to treat the tumor.
Chemotherapy is the use of strong drugs to treat cancer. Chemotherapy was first used to treat cancer in the 1950s, and research has shown it to help kill cancer cells. Chemotherapy can be given a multitude of ways, including pill form, liquid form, chemo shots, or intravenous chemotherapy.
When a cancerous tumor is confined to one location and hasn't spread, the most common treatment approach is surgery. This is usually the case with skin cancers as well as the cancer of colon, lung, and breast. If surgery cannot remove all the cancer, the options for treatment include radiation and chemotherapy or a combination of both. The risks of chemotherapy include damage to lung tissue, heart problems, kidney problems, infertility, perpetual neuropathy, and possible secondary cancer due to the chemotherapy. Risk of radiation therapy include possible secondary cancer due to the radiation, possible infertility, and depending on where the treatment is located, the patient may have possible tissue and organ damage.
To obtain a degree in either cardiology or oncology, one will have to go through 4 years of undergraduate studies to receive a bachelor's in science or math and 4 years of medical school. After one completes 8 years to obtain a medical doctor or doctor of osteopathic medicine, he or she then must complete 3 to 7 years of residency and fellowship training depending on the specialty. one would you rather be? A cardiologist studies the heart and makes up to $400,000 a year after having experience in medical facilities. An oncologist studies cancer and can make up to $685,000 a year. No matter the amount of money a cardiologist or oncologist can make, the money cannot compare to the feeling you get for changing and saving lives each and every day.